My name is Branden Murphy. I am a pediatric nurse. I have been since 2011. And my journey actually to parenthood spawned from being a nurse. I noticed very early on in my career, even before I was a nurse, really, that individuals who had suffered from head injuries or trauma that did really well are those that have super strong families that love them, right? And that will give them the resources that maybe they wouldn't get otherwise. And so I was turning 30. I did not have a kids. I really wanted a special kid. And I decided to become a foster parent.
You have at least one child that's in a care facility permanently. Your other children, are they able to receive the care that they need within the state of Nevada? Or what is it like to access the care that they need?
No. So the trouble that we have locally is we've got a lot of wonderful people. I truly believe that every one of our children's hospitals and long-term care facilities, our providers, they all do wonderful work. I have had lots of great experiences as a nurse, truth be told, and as a parent, right? The trouble is we don't have enough of the resources. We have doctors in 3 states. So we routinely go to California for care and Salt Lake City for care. If I counted it, I would venture to guess that we probably have more providers out of state than we do in state. Why is that? Well, one, there's not enough resources here. Our son that has autism got the autism diagnosis last week in Salt Lake City. There is resources here for autism, not enough, and the wait lists are like extremely long. Our son, Leon, had a surgical procedure called a selective dorsal rhizotomy in Salt Lake City. That is a procedure that is not available in Nevada because there isn't the team to perform the procedure. There's no pediatric ear, nose, and throat doctor anymore, right? So we have 2 kids with tracheostomies, and the thing that protects my son's airway, I don't have a provider in the entire state of Nevada that can do surgery on that. Not a specially trained individual. Yes, there are people that can do that, but you don't want a general surgeon operating on your kid's airway.
What would it mean to have a comprehensive children's hospital, a freestanding children's hospital here in Nevada?
It would be a big difference. When we go out of state, one of the things that we can do, and I've even noticed this in Salt Lake especially, if I go to a doctor's appointment and the provider orders labs in Salt Lake, I literally go downstairs and get the labs drawn. And sometimes that day, the provider has the results. If they need an MRI or a CT, we can cross a bridge and go to the main hospital and get it done. Here, if a provider wants labs or an X-ray, CT, MRI, these are all very common things, right? This isn't like abstract stuff. This is like every day going to a doctor for a special needs parent. We have to get the referral. The places that do all these things, there's not enough of them, right? They're overwhelmed. It's not their fault, but that things get lost so much. It can take weeks to get CT and MRI. So that'll be a huge advantage, being able to get things done. Plus, when everybody's in one building, they can communicate. They're on the same electronic health record. They can have comprehensive care team conferences. I think that's what they call it. That doesn't exist here because they're not in the same building. And they just don't have the time.
What would you say to parents who have not experienced their child needing to have a comprehensive children's hospital? And how would you say a children's hospital might be also relevant to them, knowing what you know of the facilities and how they're different?
Absolutely. I routinely encourage families to seek care in Salt Lake. Or LA. And again, that's not because the care here is not good, because it is. But you can wait a long time. You can wait on waiting lists for a long time. And you're not going to get the expertise. One of the things that often comes up is my kid has a seizure, right? A seizure disorder. There's great neurologists here. There's not enough of them. And so that's what I would tell families, is that the resources out of state are often things that we do not have here. And it is worth the drive. It is worth the 6.5-hour drive to go to Salt Lake. You'll get more accomplished and faster than, unfortunately, you will here in Nevada, or 4.5 hours to LA.